If you're running a behavioral health practice, then you already know that billing is complex. But what might not be so obvious is just how deeply that complexity is affecting your bottom line. In this explainer, we're going to uncover exactly why your specialty loses more revenue than any other, and, even more importantly, what you can do to get it back.
All right, let's just start with the single most important number for your practice. For behavioral health, the average claim denial rate is a staggering 16%.
Now, to put that into perspective, this isn't just a small variation. Other medical specialties, they average somewhere between a 5 to 10% denial rate. Behavioral health is in a class of its own, facing a systemic financial drain that is completely unique to your field.
So that leads to the crucial question: where is all this money going? The losses, you'll see, go way beyond simple denials. They're actually embedded in your day-to-day workflow in ways that are often invisible until you know exactly where to look. You see, the fundamental issue here is really a mismatch. General medical billing principles, they're built for one kind of model, but the realities of behavioral health operate on a totally different one. And trying to apply a one-size-fits-all approach is the main reason for revenue loss. And it all starts with one key difference.
And this illustrates the core difference perfectly. In most of medicine, billing is procedure-based. You do a service, you bill for that service. Simple. But in behavioral health, your reimbursement is tied directly to time, the exact number of minutes in a session. This single distinction creates costly complexities that standard billing systems just aren't designed to handle.
And here on this slide, you can see exactly how those unique problems translate into direct financial hits. We're talking about miscoded time-based sessions that cost you $50 a visit, to expired authorizations causing thousands in denials, to claims being sent to the wrong insurer altogether. This is precisely why a general, non-specialized billing approach just doesn't work.
Okay, so let's break this down even more. We're going to look at the three biggest and often most overlooked revenue leaks where your practice is losing money that it has already earned.
By far, the most common and the most costly error in a therapy practice is billing the wrong time-based psychotherapy code. It's wild, but the financial difference between billing correctly and incorrectly often comes down to just a few minutes.
Just look at this breakdown. Let's say a session runs 53 minutes, but it gets billed with the common 90834 code. You've just lost revenue. That one extra minute makes all the difference between two separate codes and two very different reimbursement rates. So the bottom line is, without really precise tracking, you are constantly underbilling for your time.
Let's actually put a dollar amount on that. For just a single therapist who consistently runs longer sessions but bills that standard code, this one error can cost the practice over $52,000 a year. That's not a lost opportunity. That's earned money that's just being left on the table.
Now, for prescribers, the biggest source of lost income is totally different, but it's just as big of a deal. It's the failure to bill for psychotherapy that's provided during a medication management visit.
This chart shows the impact so clearly. Most billers, they'll just submit the Evaluation and Management, or E&M code. But if psychotherapy was also part of that visit, a specific add-on code absolutely must be included. By billing the correct E&M code plus the psychotherapy add-on, like Medtransic does, you capture the full, accurate value of that comprehensive visit.
And the financial impact? It's massive. We're talking about a 27 to 54% increase in revenue from a single prescriber visit. And what's really important is this doesn't require any change in how you practice. It is purely about billing accurately for the amazing, comprehensive work you're already doing.
And finally, we get to the single biggest reason for denials in all of behavioral health: expired prior authorizations. This is a silent revenue killer, and yet it is almost entirely preventable.
Unlike, say, a one-time surgical authorization, therapy requires constant, ongoing tracking. As this chart shows, a single lapse might seem small at first, but it just compounds so quickly across your patients and over time, easily costing a practice over $50,000 a year in denied claims that are almost impossible to appeal later.
So how do you solve these problems that are so deeply embedded in the system? Well, you need a workflow that's designed from the ground up, specifically for the complexities of behavioral health. A specialized workflow has to directly counter every single revenue leak we talked about. It must track the entire authorization lifecycle to prevent any lapses. It has to validate time and add-on codes on every claim. It needs to verify insurance carve-outs before the first visit ever happens. And finally, it should monitor billing patterns to protect you from audit risk. This is the system Medtransic provides.
So what's the actual direct outcome for your practice when you implement a specialized billing solution from a partner like Medtransic?
The results are tangible, and they're fast. A 15 to 25% increase in your collections within the first 3 months. And what's really important to understand here is that this increase doesn't come from seeing more patients. It comes from being paid correctly for the work you are already doing.
And that really is the crucial takeaway. The revenue was always there. It was earned by your providers. It just wasn't being captured by a billing system that truly understood the unique financial rules of your specialty. A specialized approach, like the one from Medtransic, is designed to make sure you collect every single dollar that you rightfully earn.
So, if you're ready to stop these revenue leaks and really secure the financial health of your practice, the first step is a simple one. We encourage you to contact our business development team here at Medtransic to schedule a consultation.
At Medtransic, we look forward to sitting down with you and showing you exactly how much revenue we can recover for your practice.